Welcome to the Health Rising podcast, where we empower you along your health journey. I'm your host, Dr. Jordan Salmon, and together we'll explore the steps to greater health, hope, and happiness. Let's rise together. Welcome back to the Health Rising podcast. It is good to be with you. It is a beautiful sunny day here in Houston. Make sure you take some time to get outside, enjoy the beautiful weather, enjoy this beautiful earth and everything that it has to offer. Today we're going to conclude with the Health Rising pathway. And the last step that we're going to be going over is our do-over. I think that this is the greatest gift that we have. I'll share a quote regarding this. I first heard this on Kung Fu Panda, so full disclaimer there. Looking it up, it looks like this may have been a quote from Bill Keane, who was a cartoonist. But the quote says, "Yesterday is history, tomorrow is a mystery, today is a gift of God," which is why we call it the present. So I love this quote because really all we have is today. Today is that opportunity to do over. We have all defaulted again and again in life at things that we're trying to improve, things that we want to change. We don't like this or that, and we default back to what we're used to. And today is another opportunity that you can do over, that you can change, that you can try again. And that truly is, I think, one of the greatest gifts of humanity, that we can just try again and go at it one more time. I want to talk with you for a minute about New Year's resolutions because I think these have a bad rap. So, typical New Year's resolutions, about 50% of Americans will make a New Year's resolution every year. About 1 in 10 will actually accomplish their New Year's resolution. And I've heard it said by, various individuals that then we really should just stop making New Year's resolutions because of how infrequently they are actually accomplished. And from someone who has defaulted many, many times, my opinion on this has dramatically changed. And I think that we do not need to stop making New Year's resolutions. What we really need to be doing is making more New Year's resolutions and do them more often. We should be making monthly resolutions, weekly resolutions, daily resolutions, failing again and again and again. If 1 in 10 of our resolutions will come true, then we need to make 100 resolutions. And 10 of those will come about, statistically speaking. Hopefully we get really good at it, and then we can make really informed resolutions, and we can just get better and better at it. And that is kind of what we're trying to get at here with the Health Rising pathway. It's about the do-over process. It's about trying again. It's about defaulting to what we're used to doing, but then taking an opportunity to evaluate that default, evaluate that failure, and say, what went wrong? And we discover in that process how to make it better and how to try again in a different way. If we're doing it the same way again and again and again, then it's probably not going to change the end result. But if we're taking an opportunity to evaluate it and say, this is where I fell short, and I think it was because of this specific scenario, or this was what was wrong, then that allows you an opportunity to try something a little bit different. And you can just try again a little bit different, being really intentional in those efforts and do over. And that is a gift. So continue to default. Don't be afraid of the default. Relish in it. It's an opportunity to try again and to do over until you can get it right. And that is how I want to view things, especially if something is important. Your health is essential. That is important. And I think too many of us are viewing health from we view it from the perspective that it's not that important. But yet, we do believe that being there for our children, or being there for our pets, or being there for our spouse, or our friend, our neighbor, our community, we think that's important. Well, then health is of utmost importance, because without health, you cannot be there for those people who you love. So if you feel like it's important for you to be there for those who you love, then it is important for you to have health. And the health rising process is all about making health a priority, being intentional in our day to day living so that we do enjoy good health. Best way that we can bring about those significant health changes that we really need in our lives to have the best long term health prognosis is for us to do things today. Small things every day, improvements over a lifetime will yield extremely beneficial results that will get us to where we want to be. And that is what this is all about. I became really passionate about this whole concept, not because of my training as a physician, but because of my experiences as a patient. I've talked a lot about losing weight and about my mental health journey and how important those things have been to starting my business, starting this podcast, doing a lot of the things that I'm trying to do, because the way that I see it is we are failing our patients when we're not talking about these things. We're not talking enough about nutrition. We're not talking enough about exercise. And these are things that we give lip service to in some ways, but we're not explaining exactly how to bring them about. And that is what I am trying to teach on this podcast. I may not be the best at that. I do much better in a face to face visits. So if you have feedback, please give it. But I'm going to keep going with trying to help you understand how we can really improve our health. So with these small little changes over time. And when I lost 65 pounds, it changed my perspective on a number of things that I do and how I counsel my patients and how I talk about health. And patients will often ask me, or just friends will ask me, well, how did you lose that weight? And I think that what a lot of people are really wanting is a quick fix, a quick answer to, oh, this is what you do. If you just do this, then the weight will come off. And we see that with a lot of our current medical treatment models and surgeries and so forth. And I don't want to downplay them. I think that they can be beneficial, but I think they are short sighted, because to maintain a healthy weight long term means that we need to learn a new way of living, develop a new pathway for our day to day, small, seemingly imperceptible changes on a regular basis that get us to a place that we never thought we would ever arrive to. So, how did I lose the weight? And I think that everyone wants just one answer, and there's not one answer. I used the health rising pathway that I'm teaching for multiple different things that all combined together to ultimately result in a much improved day to day healthy living, more energy, better sleep, and a overall improved health. One of those examples is trying to get vegetables in my diet. So that didn't initially start out as something that I was passionate about. I really was just trying to lose the weight. And in trying to lose that weight, I started learning about the caloric density of foods, and learning how many calories are in different foods. And in that process, I did a little project that was kind of fun. It was my 100-calorie project, where I would just take foods and I would put 100 calories on a plate, the same plate, and then take a picture of it. And I did this with multiple different types of foods, a lot of ultra processed foods, vegetables, fruits, just anything that you could really buy from a store. And I did it with, lots of different objects. In that process, I learned a lot. But the biggest thing I learned was you could eat a lot more vegetables, and that would be 100 calories than if you ate chocolate or many other of the candy or hyper ultra processed foods that we often will consume. And so I started recognizing the importance of getting vegetables in my diet and even stopped counting vegetables as calories because of how low their calorie content was. And then I began the process of, okay, well, now how do I get more vegetables into my diet? And I had to work on that with various different pathways. Obviously, I had to have more vegetables in my home. But then when you have more vegetables, sometimes you end up throwing out more vegetables. So, how do I actually get them eaten? And in order to do that, I had to prepare them more regularly or eat them in various different ways. Cooking them, involving them into our meals. My wife being on board with this has been a huge help in helping me in that process. And we together have improved our diet and improved the way that we live. And so we would buy a lot more from the grocery store. Well, then we were trying to figure out how to just get those vegetables and make them easier to eat, right? Reducing the barriers. We've talked about that. And that's what bore this idea of the vegetable box. And this is a large Tupperware, extremely large Tupperware that we keep in our fridge. And we've had this for many years now that we will fill with pre-cut, pre-prepared vegetables. So when we bring all the vegetables home from the grocery store, we will just cut them all up and put them in the box. And that box will last us multiple days with our whole family, bringing that out with multiple meals throughout the day, throughout the week. And that has made getting vegetables in our diet extremely easy, very quick. The food is just ready to go. And that, I'm trying to illustrate here, getting vegetables in our diet had taken multiple steps and processes and understandings and learning things and some defaults and getting to the point that, okay, this is one way that will work for us to improve our dietary intake. And when we talk about weight loss and that journey, that process, I talk about it sometimes like I'm there, like I've arrived. And I want to dispel that myth right now because I have not arrived. There is not an arrival point to get to. This is something I continue to work on day in, day out. I'll be real with you here for a minute. Starting a business, starting a podcast, leaving the security of what I knew previously has been extremely challenging and very scary and stressful. And that stress has made it really difficult to tune in to my hunger cues more regularly and know when I'm satisfied in eating because I almost always have this constant stress in my stomach that's just ongoing. And so I'm learning again and practicing again to tune in to my body and ensure I'm drinking enough fluids and that I'm eating because I'm really hungry and not because those stress levels are just constantly eating at me. So, this is a process that has taken me years and will continue to take me years. And I hope that I'm just always improving, that it's not getting to a specific weight or finally, getting this or that. It's about just learning the way of living healthy and living day to day, the healthiest day that I can live today, and recognizing when I've slipped up, when things aren't going well, and you guessed it, having a do over, right? getting another chance each day I wake up. Such a blessing to be able to say, last week, yesterday, last month, whenever, things didn't go so well, but I'm here. And today I can try again. I get a do-over. Let's make today a little bit better than yesterday. So when you look at how I've drawn my interpretation of the health rising process with this triangle, and we zoomed in on kind of the various different aspects of each step and what needs to happen with each of those steps. And now I want to take a second to just zoom out. So this whole health rising process is not meant to be done one time. As I've talked about again and again, this whole process is meant to be repetitive. It's meant to be iterative. This process means that you grow and you improve with trying again and again, over and over, that as the progression of time goes, that you would continue upward in your trajectory towards improving and improving health with each small little health rising process of defaulting, discovering, and doing again, right? Your do over again and again. And the goal is that we continue to improve ourselves and make our health the healthiest that it can be. So, repetition is really what we're looking for. That is the process of improving our health. It is not one giant leap or bound. That has been how we have had some significant improvements in our health with giant leaps and bounds. But much of our current day's health problems focus on the chronic issues that come about because of our lifestyle choices day in and day out. And those lifestyle choices are critical each day to becoming and living the healthiest that we can live. And that is where I hope we can go with this health rising process. So again, when we go back, let's consider the going through a heavy brush area, lots of bushes everywhere, right? Going through the jungle or the forest or whatever it is. Those pathways that have been trotted time and time again are the easiest ones to go down. And so we are trying to pave a pathway for our daily living that is the healthiest pathway that we can pursue. And that is the way that we will have the healthiest version of ourselves. We're not looking for one giant effort, one big thing to change, that will fix everything. That is not how real health is obtained. Real health is in daily decisions, making small choices that improve our health in miraculous ways. That's what leads to massive amounts of weight loss as we become the healthiest version of ourselves. One study done by the Journal of American Medical Association, the authors estimated that 80% of premature death in the United States was because of poor lifestyle. 80%. I think that we really need to be focusing on our lifestyle choices, and that is the key to improving our health of today. When we think about my patients, who I've had, unfortunately, too many patients who die from alcohol related complications. Which alcoholic beverage was the cause of their death? It wasn't one particular drink. All of the alcoholic beverages cumulatively have led to their unfortunate healthy outcome. Similar for any addiction, for smoking, for drug abuse, all of these addictions that we struggle with. Similarly, I don't think of heart attacks as happening in a single day. While it is true that that heart attack comes to a head, or that, once it's occurred, that is a very important day in terms of receiving medical assistance and making significant changes. But heart attacks occur over years, perhaps decades, of dietary and lifestyle choices that lead to buildup in our arteries that eventually result in those, they call them plaques, right? The material coming off of the walls of our arteries and ending up in the places where we don't want them to end up, in our hearts, and lead to our heart attacks. How do we prevent heart attacks, or how do you treat a heart attack? You treat it today. You treat it before it happens. You prevent the heart attack with daily decisions that will ultimately lead to a healthy heart. As a family physician, I think I treat more heart disease than any cardiologist, because I am treating heart disease every time I talk to a patient about anything that will ultimately improve their heart health and prevent a heart attack. This similar mindset needs to be similarly applied to many of the complications that occur from diabetes, many of the complications that occur from really any chronic disease, from neurodegenerative disease, right? So, brain diseases, dementia, all of those, and there have been multiple studies that are coming out about this. Their risk is lowered with dietary changes, with improving our lifestyles, and that reduces the risk of dementia and neurodegenerative diseases. Now, the challenge in our current healthcare system is that while lifestyle changes, improving our diet, getting more exercise, doing those things that improve our health, we know that those are critical for reducing the number of chronic diseases. And yet, our current healthcare system is not set up to reimburse financially those individuals who are doing those things or trying to do those things. And that is the unfortunate reality of our current healthcare system. That is why I have moved away from an insurance-based healthcare, because I do not believe that it is in the best interest of my patients. And I have transitioned to a different type of medical practice. I currently practice in what's called direct primary care. Direct primary care is a membership model where we accept a monthly fee, and we can take care of our patients. We can focus on lifestyle changes. We can focus on those things that truly improve the health of my patients and make their health the priority, as opposed to those items that insurance companies are going to reimburse an individual for. And that is just something that I think we need to have a mindset shift in our current healthcare model, because it is not doing the job. It is not doing what we want it to do. Many people call it a sick care model. And I think that it is failing in that it is not doing what we need our current healthcare system to do. And that is what the health rising process is about. It is about learning those things, developing those lifestyle skills, those habits on a day to day basis that will lead to improved health today and in our future. Now, will living this healthier lifestyle truly reduce all cancers, all heart attacks, all dementia? Nobody's going to get diabetes anymore? Absolutely not. But it significantly reduces your risk and improves your overall health. And I think a big part of health as well is that mental health, the capacity to deal with those stressors that do come. People who are living perfectly healthy lives will still get cancer. Trauma will still occur. Dementia will still happen. People still get diabetes. Changing our lives entirely will not eliminate all of these diseases from society, but it will improve our odds of dealing with them. And then improving our mental health will allow us to handle those situations, to go through them, and to deal with those challenging diseases with more hope and more happiness. So, I plan to, in future episodes, well, there's a lot of ideas of things that I'd love to talk about, but I would like to talk kind of more in depth and go through the health rising process of what that really looks like for maybe one very small specific example. And I'm happy to take, if there are challenges that individuals are struggling with and they need assistance with this, I'd love to have some more real life examples. I like using my own real life examples because I think that tells you how I've experienced it and how I view it and how I've gone through it. But I'm also happy to help and assist individuals who are trying to improve their lives and are wondering for ways to work on these things. So if we just zoom out real quick and go over all of these steps that we talked about, initially, this health rising pathway starts with a desire. You see what's going on in your life, you see your health, or you read these articles and you read about these studies that are coming out about how important our lifestyle is to preventing long-term chronic illnesses, and you want to get ahead of these things. That is great. That is a huge desire, and that is the first step in this health rising pathway. So then you're going to decide on one particular item that you believe you can do that would improve what you hope to improve. And being very specific is important here, considering multiple options, but then ultimately deciding this is the thing that I think would be most beneficial. And hopefully, your medical provider can assist you with this if you need assistance. Reach out to me if you're struggling with any of these steps, and we can walk through them. Then you're going to do it. You're going to you write out your implementation intention, right? You write out specifically what you intend to do that you've decided on, and then you do it. You go and you make it happen. And like any changes, you're going to have resistance and you're likely going to struggle in that process of making that a new habit. And you're going to default, right? That's the word that I love, that I prefer, that is our failing process. It is a step forward. We default in this pathway of growth and learning and improving our health. And in that default, then we have a trigger, a timing that we can stop and take a look and review and say, wow, this was my intent. I wanted to do this. I had these great plans, but I haven't done it. It's not working. And we discover what went wrong. We discover how we can improve, what we can change. What are those barriers that are holding us back? What are some barriers that we can set up to prevent us from going to the default pathway? And then we do over. We go again, and we have one more opportunity to try again. And that process continues and continues and continues over and over and over with multiple different actions, lifestyle changes, improvements, avoiding things that we're trying to get away from in order to have the healthiest version of ourselves today. And let me just talk for 1 second on that particular word, today. I think I've met various individuals who haven't achieved the weight loss goals that they are looking for, and they struggle to recognize the power of their choices today. while many individuals who are beginning to lose weight or beginning any process of trying to improve their health, I helped an individual recently with anxiety challenges that they were struggling with, and any improvement towards where you want to be is an improvement that can be celebrated, and that can happen today. While you may not have the results on a scale that you hope for, or that you aren't able to fully deal with the mental health in the way that you want to, but having improvement in your mental clarity or improvements in your energy levels, in your sleep, there are many benefits of this process of improving health. So recognize that each day of your health journey is another day to improve and another day to receive the benefits of healthy living. And you can feel that benefit today. You don't have to wait until all the weight is off that you're hoping to lose. You can recognize the benefits of your improved health today. I love a quote by C.S. Lewis. That's where I want to end with this. You can't go back and change the beginning, but you can start where you are and change the ending. What a beautiful mindset. I hope we can all take that and go forward today with one thing that will improve our overall health. And stop trying to do everything. Just focus in on one thing today that you can work on that will improve your health. Down the road, you will thank yourself for what you did today to improve your health. Send me your questions, your concerns. I want to hear from you. I want to know how I can help you. And what are some of the things that you are struggling with? What are some of the things that you are challenged with? And what are some of the desires that you want to improve? And maybe struggling with some of the decisions of how you can really get down in this process of the health rising process to improve your health. I'd love to hear from you and love to help you out in that process. So send me an email, jordan@healthrisingdpc.com. Until next time, bye. Thank you for joining me for this episode of the Health Rising podcast. I practice as a direct primary care physician in the Houston, Texas area. You can read about my blog and learn more about direct primary care at healthrisingdpc.com. If you have any questions or thoughts you'd like to share, feel free to message me on X or on Instagram at healthrisingdpc. Until next time, remember to choose health and be kind to yourself. This podcast serves solely for educational purposes. The information provided here is not intended to be medical advice. Listening to this podcast does not establish a doctor-patient relationship between the hosts, guests, or anyone associated with the podcast and the listener. For personalized medical advice tailored to your specific health concerns, please consult your own family physician. Any interactions with patients or experiences shared in this podcast have been altered to ensure confidentiality and comply with HIPAA regulations. Names, genders, diagnoses, and any potentially identifiable information have been modified to protect the privacy of individuals. By continuing to listen to the Health Rising podcast, you acknowledge and agree to these terms.